Hello everyone, my name is Dr. Ravi and I'm a nephrologist. I've been practicing at Apollo hospitals for the last 20 years. Today we're going to discuss about pedal edema in regards to the causes and the management. Now medical terms, in medical language, feet are known as pedal and edema refers to swelling. So pedal edema refers to swelling of the feet and the ankles. Now don't confuse this with swelling all over the body or generalized swelling, which is called anasarca. We're going to discuss mainly about swelling of the feet today. Pedal edema is the causes are broadly classified into medical and non-medical, or pathological and physiological. The common non-medical causes for pedal edema or swelling of the feet are drinking excessive water, having a lot of salt, being obese, and not moving around too much. So standing or sitting at prolonged times in a particular place can cause pedal edema. So make sure you get out of bed, walk around, reduce the salt and water in your intake. Of more importance are the medical causes of pedal edema or the pathological causes. To understand this easily and to remember it better, let us look at the human body from head to toe, and that will help us remember the causes of pedal edema more easily. Let's start with the eyes. When you look at the eyes, we look for pallor or a pale coloration, which is also known as anemia or low hemoglobin. Anemia or low hemoglobin is an important cause of pedal edema. So the eyes will tell you if you have any anemia or pallor, and that could give you one of the reasons for low hemoglobin and for swelling. The next is the mouth, and when we look at the mouth, we are talking about any ulcers in the mouth which could be because of malnutrition or vitamin deficiency, and that can cause pedal edema. Drinking a lot of water or taking too much salt can also cause swelling because of water retention and can cause pedal edema. Nutrition, if it is poor, the protein levels will be less, and if you take less protein, that can cause swelling or pedal edema. Now remember, there's a big misconception that you should drink lots and lots of water to maintain your kidney function. This is not true, and people end up drinking 5 to 6 to 7 to 8 liters of water per day. This is not required. 2 to 3 liters of fluid intake per day is the general recommendation to keep your kidneys healthy. If you drink too much, you can have pedal edema again. Again, taking too much salt can cause pedal edema. Taking too less protein can cause pedal edema. So these are the causes related to the mouth which can cause pedal edema. Below that, we look at the neck and we look at the thyroid gland. If you have low thyroid levels or hypothyroidism, that can cause pedal edema. Below that is the chest wall and the chest cavity where the heart lies. So anybody who has heart disease, for whatever reason, whether it could be cardiovascular disease, coronary vascular disease, valvular heart disease, or general weakness of the heart leading to some kind of heart failure, this can cause swelling of the feet and pedal edema. So any heart related ailment leading to heart failure can cause swelling of the feet. Below the heart is the liver, and anybody who has chronic liver disease, for example those with cirrhosis, can have low protein, and this causes retention of water and salt and can cause pedal edema. Below the liver are the kidneys, and the kidneys are one of the commonest cause of pedal edema, because if you have a high creatinine or kidney dysfunction, that can cause retention of salt and water, and that can cause pedal edema. Sometimes there are very subtle disorders in the kidney where you have leakage of protein in the urine called nephrotic syndrome, and nephrotic syndrome patients will have pedal edema. If you look at all the causes of pedal edema, probably the kidney is the most common cause of swelling of the feet. Finally, going down to the urinary tract, if you have any obstruction in the urinary tract because of stones or some problem in the bladder or some problem in the urethra, this causes retention of urine, causes retention of water, and causes swelling of the feet. And finally, the legs themselves. So if you have any problem in the feet or in the legs, that can cause swelling. For example, if you have an injury and you have trauma and you have a fracture, that leg will be swollen. Or if you have a clot in the veins of the leg called deep vein thrombosis or DVT, that can cause swelling. Infection on the skin of the legs called cellulitis can cause swelling. Varicose veins, if you have them and you're standing for a long time, that can cause swelling. So any of these things, local causes of swelling like vein thrombosis, DVT, or cellulitis, or trauma can cause swelling in the legs. But the difference is it's usually on one side, it's not on both sides. So the usual medical causes of swelling are usually show swelling on both legs, whereas local causes usually will have swelling on one leg. And most important, there are certain drugs which can also cause pedal edema or swelling. Drugs like some antihypertensives or BP medications, some blood sugar medications, oral contraceptive pills, some painkillers, all these can also cause swelling. So remember, in conclusion, pedal edema is very common and multifactorial. It's important to identify the cause so that you can treat it more appropriately, and you have to treat it with lifestyle modifications. So take less salt, don't drink too much water, exercise regularly. These lifestyle modifications should be made. Make sure you tell your doctor what all medications you're taking so those can be adjusted accordingly, and do whatever tests the doctor advises, whatever blood urine tests, scans, or whatever are required to identify the cause of the swelling and the pedal edema. Once you identify it, treatment becomes very much easier. And remember, it's important to identify the cause so that the treatment is better and more appropriate. And pedal edema can be a harbinger of some other problem in the body, so you need to identify and treat it quickly. So thank you all very much for your attention. All of you, please have a wonderful day. Thank you.